Yeah. So what is heart failure? You write heart failure underlines here. It is the failure of heart to pump. It is the failure of heart to pump. It is a failure of heart to pump or failure of heart to maintain adequate cardiac output. It is a failure of heart to pump or failure of heart to maintain adequate cardiac output. Failure of heart to maintain adequate cardiac output. Already we know the normal cardiac output is 4 to 7 liters per minute. Already we discussed that. So in heart failure, the cardiac output will be very less. It will be 3 liters, 2 liters and all. Okay. So cardiac output become very less. So now we'll discuss about the two types of heart failure. Okay. There are mainly two types of heart failure. That is the right side of heart failure and left side heart failure. Okay. So what is the main difference between right sided and left side heart failure? What symptoms you can expect? So right side heart failure means we can see full body changes like jugular vein distension, edema of fingers and hands, hepatosplenomegaly, sacral edema, ascites, edema of legs. So that means head to foot edema we can notice. Right side heart failure means. But left side heart failure means left L for lung related changes. You want to know left L for lung related changes. So you write like this. Right side of heart failure equal to right side of heart failure equal to right side of heart failure equal to full body changes. Full body changes. Full body changes. Full body changes. What all thing we can include? Jugular vein distension. Jugular vein distension. Jugular vein distension. What is jugular vein distension? Neck vein. Neck vein will be distended. Okay. Then edema of fingers and hands. Edema of fingers and hands. Hepatosplenomegaly. Hepatosplenomegaly. Edema of fingers and hands. Hepatosplenomegaly. I don't want to switch on the video. Hepatosplenomegaly. Sacral edema. Sacral edema. Sacral edema. Nocturnal diuresis. Nocturnal diuresis. Nocturnal. Nocturnal diuresis. What do you mean by nocturnal diuresis? Nighttime urination. Nighttime urination become very high. Nocturnal diuresis. Edema of lower extremities. Edema of lower extremities. Edema of lower extremities. Okay. So right side heart failure can be what? Full body changes. Okay. So head to foot changes. Along with that, you can also write increased BP due to fluid overload. Increased BP due to fluid overload and decreased BP due to pump failure. Increased BP due to fluid overload and decreased BP due to pump failure. Increased BP due to fluid overload and decreased BP due to pump failure. Pump failure means the BP will be decreased. Okay. So we can see what? Head to foot changes in right side heart failure. And one more point you want to include. Increased CVP, low cardiac output. Increased CVP and low cardiac output. Increased CVP and low cardiac output. Okay, CVP means what? Central venous pressure. That will be increased. Okay, CVP. Increased CVP and low cardiac output. Low cardiac output. Okay, next line you write left side heart failure. Left side of heart failure. Just round it L. L round here. Just round. L just round here. Okay, left side heart failure. L for what? Lung related changes. You write lung related changes. Lung related changes such as dyspnea, dyspnea, tachypnea, dyspnea, tachypnea, cyanosis, dyspnea, tachypnea, cyanosis, hypoxia, dyspnea, tachypnea, cyanosis, hypoxia, dry hacking cough, dry hacking cough, nocturnal dyspnea, Here you want to remember nocturnal dyspnea. That means nighttime dyspnea. The nocturnal diuresis. Next line. Increased BP due to fluid overload. Increased BP due to fluid overload. And decreased BP due to pump failure. Increased BP due to fluid overload. And decreased BP due to pump failure. Decreased BP due to pump failure. Okay. And increased PAWP and low cardiac output. Increased PAWP. Increased PAWP, low cardiac output. PAWP means what? Pulmonary artery wedge pressure. Increased PAWP means what? Increased pulmonary artery wedge pressure. Increased pulmonary artery wedge pressure. And low cardiac output. Increased pulmonary artery wedge pressure and low cardiac output. Okay, PAWP increase of cardiac output decrease. Okay, what is PAWP? What is CVP? This whole thing I will explain. Okay, how this will increase. I will just draw it. Okay, just listen this. Okay. So I'll just write here, right side of heart failure. Okay, just listen carefully. Okay, very important diagram. Okay, you'll get lots of questions from this. Okay, so this is a liver. Okay, so spleen, portal vein. Okay, this is superior vena cava, and this is inferior vena cava. Okay, so what will happen in right side of heart failure? Okay, just listen very carefully. Right side of heart failure, you want to remember right ventricular failure. Right ventricle fails to contract. Okay, right ventricle fails to contract. So as a result, what will happen? This will backflow to the right atrium, then to the superior vena cava. Moreover, this also will backflow to the inferior vena cava. This two arrow mark is very, very important. Okay, it will backflows to the two area, superior vena cava and inferior vena cava. So superior vena cava pressure increases, then it is what? CVP increased. Increase CVP, central venous pressure increase. And you know, the cardiac output will be dropped. Increase CVP and cardiac output decreases. Okay, and moreover, what will happen from here? This will be backflow to the head and upper extremity. Head and upper extremity will be backflow. This can result in what? Jugular vein distension, edema of fingers and hands. Edema of fingers and hands. And inferior vena cava backflow to the legs. So there's a chance for edema of lower extremities. Edema of legs. Okay. and inferior vena cava backflow also goes into the liver, and the liver will be enlarged, hepatomegaly, and spleen also enlarged, splenomegaly. This pressure will goes into the portal vein. So portal vein congestion will be there. This can lead to fluid accumulation in the stomach. That is ascites. Ascites. So this is how we can see what right side heart failure symptoms. Mainly you want to remember these two error mark. Okay, superior vena cava and inferior vena cava backflow. Superior vena cava and inferior vena cava backflow. Take screenshot. Okay, once again I'll repeat. Okay, so first of all, right ventricle fails to contract means what? This will backflow to the right atrium, then to the superior vena cava. So superior vena cava pressure will be increased. That we call it as CVP. Pressure in the superior vena cava is CVP, central venous pressure. So it is now increased, and cardiac output decreased because ventricle fails to contract. So this will backflow to the head and upper extremity. So head area pressure increases, jugular vein distension, and upper extremity pressure increase, edema of upper extremities. Then inferior vena cava backflow can lead to edema of lower extremities, and this will also will backflow to the liver, spleen, and so hepatosplenomegaly. The portal vein pressure will be increased. This can lead to fluid accumulation in the stomach, ascites. You got it? Took the screenshot, right? Next, I will discuss left side heart failure. Left sided heart failure. How left side heart failure, we can see lung related changes. I'll just draw it. Okay. Left side heart failure, that means left ventricle fails to contract. Left ventricle fails to contract. So this can lead to backflow to the left atrium. This leads to backflow to the left atrium. From left atrium, it backflow to the pulmonary vein. This is what pulmonary vein. So pulmonary vein pressure increases. We call this pulmonary venous congestion. Okay. Pressure in the pulmonary vein increase, pulmonary venous congestion. From here, this will backflow to the lungs. So what will happen? The pressure in the lungs will be increased. So it is what? Pulmonary hypertension. Pulmonary hypertension will be there. Moreover, from lungs, this again backflow to the pulmonary artery. This is pulmonary artery. So the pressure from the lungs will directly backflow to the pulmonary artery. You can see it. This will come back to the pulmonary artery. This is pulmonary artery. So pressure in the pulmonary artery increase. That we call this increased pulmonary artery wedge pressure. Increased pulmonary artery wedge pressure. And here also cardiac output decrease because left ventricle fails to contract. Okay, so you can see here this arrow mark you want to remember. First, this will backflow to left atrium, then to the pulmonary vein, then to the lungs. From lungs, it will backflow to the pulmonary artery. So pressure in the pulmonary artery increase pulmonary artery wedge pressure, low cardiac output. So it is very easy to remember. Left sided L for lung related. So what is the other synonyms of lung? Pulmonary hypertension, pulmonary venous congestion, then pulmonary artery wedge pressure. Everything is related to pulmonary, lung and pulmonary, lung or pulmonary. Take screenshot. So I hope everyone understood this, right? Right side and left side, you write one question. Patient is diagnosed with a left-sided heart failure. Patient is diagnosed with a left-sided heart failure. Patient is diagnosed with a left-sided heart failure. What symptom can be expected in this patient? What symptom can be expected in this patient? What symptom can be expected in this patient? Repeating, a patient is diagnosed with a left-sided heart failure. What symptom can be expected in this patient? What symptom can be expected in this patient? Okay, first option, pedal edema. Pedal edema. PEDL, pedal edema. Second option, ascites. ASCITS, ascites. Third option, air hungerness. Air hungerness. And last option, splenomegaly. Splenomegaly. Just comment your answer. Is it A, B, C, or D? In Zoom chat, just comment. A or B or C or D. Okay, a patient is diagnosed with left-sided heart failure. What symptom you can expect in this patient? Is it pedal edema, air hungerness, hepatomegaly? So which one? What is the thing? This is what air hungerness. Air hungerness. So why it is air hungerness? Because left-sided heart failure, you can see what? Lung-related changes. Lung-related changes you can notice. So that's a point. Okay. So next we'll be discussing about the management for heart failure. Right. Management. Management for heart failure. Okay, what are the management for heart failure? First, you want to provide what? High follows position. High follows position. High follows position. കൊടുക്കാം. Administer oxygen. Administer oxygen. High follows position. Administer oxygen. Thirdly, if the patient is showing pump failure symptoms, digoxin. Okay, you're right. The patient is showing pump failure symptoms. The patient is showing pump failure symptoms. Digoxin is the drug of choice. The patient is showing pump failure symptoms. Digoxin is the drug of choice. The patient is showing pump failure symptom. Digoxin is the drug of choice. Next line, if the patient is showing fluid overload symptoms, the patient is showing fluid overload symptoms. The patient is showing fluid overload symptoms. Then what we will give? Fluid overload and acids also. The patient is showing fluid overload symptoms. Then lacids or furosemide is the drug of choice. Lacids or furosemide. Lacids or furosemide is the drug of choice. Lacids or furosemide is the drug of choice. Okay, so you understood the difference. Pump failure means digoxin, fluid overload means lacids. Okay, next they have asked this: what are the two most important nursing assessment for the patient with heart failure? Two most important nursing assessment are what? One is intake output, and secondly weight. So these are the two most nursing assessment. So right, monitor intake output and weight. Monitor intake output and weight. So heart failure, the most important two nursing assessment are what? Intake output and weight. Okay, intake output and weight. Okay. So next you write in bracket of monitor intake output and weight. Weight is the best indicator of fluid status in the body. Weight is the best indicator of fluid status in the body. Weight is the best indicator of fluid status in the body. Weight is the best indicator of fluid status in the body. For example, if weight increased in heart failure, patient, weight increase in heart failure patient, what it indicates? If heart failure patient weight is increased, what it indicates?
Fluid
Fluid
overload.
retention. Fluid retention. Okay. Weight increase in heart failure patient, then it is fluid retention. Then it is fluid retention. Okay. In case weight loss occurs, in case weight loss occurs, in case weight loss occurs, it indicates efficiency of treatment. In case weight loss occurs, in case weight loss occurs, it indicates efficiency of treatment. Treatment is effective. Like, in case weight loss occurs, it indicates efficiency of treatment. You understood this? Okay. Okay. Next line, you write. Monitor the urine output. We already discussed now. What is the normal urine output? You just mentioned that. Not normal urine output is 30 ml per hour. 30 ml per hour. Normal urine output is 30 ml per hour. And below that, you write as per the body, as per the age, as per the age, as per the age and body weight. Just write as per the age and body weight. You write like this as per the age and body weight. If they ask as per the age and body weight, for example, for infant, 2 ml per kg per hour. 2 ml per kg per hour. For infant, 2 ml per kg per hour. For example, if baby weight is 6 kg, then urine output is how much? Urine output 12 ml per hour. 12 ml per hour. Okay. And second category is for children. For children, 1 ml per kg per hour. 1 ml per kg per hour. For example, baby weight 10 kg. Okay. So urine output is how much? 10 ml per hour. Urine output 10 ml per hour. Okay. And for adult, it is 0.5 ml per kg per hour. 0.5 ml per kg per hour. For example, 80 kg means then urine output is 40 ml per hour. Half year. 80 kg body weight means half. 0.5 ml per kg per hour means just half it. Okay. So you want to remember here doubling on. What is the weight? That doubling on. Here's weight, how much? Same urine output. 10 kg means 10 ml. And here, how much is the weight? That half you want to take. You got it? So as per the body weight, if they ask you the urine output, this is the formula. Each category, age category. Okay. You understood this? Okay. So infant and double, children are same. What is the weight? Same ml. And adult means half of the body weight. Okay. So why it is at most important to monitor the urine output? Because once the heart pumps, 20% of cardiac output is gone for renal perfusion. 20% of cardiac output is for renal perfusion. So that is the reason what for cardiac patient view, it is at most important to monitor the urine output. If cardiac output increase, urine output increase. If cardiac output is very less, urine output decrease. So in heart failure patient, if urine output is less, that means heart is not pumping efficiently. Heart pumping is very less. So you got it. So that is the reason it is at most important to monitor the urine output of heart failure patient. Okay. What are the other assessment you want to do? Monitor the CVP. Monitor the CVP. Monitor CVP. CVP is how much? CVP 3 to 8 normal. Normal CVP is 3 to 8 mm of H. Normal CVP is equal to 3 to 8 mm of H. Normal CVP is equal to 3 to 8 m of H. Okay. And monitor PAWP. Monitor PAWP. PAWP means what? Pulmonary artery wedge pressure. PAWP, how much it is normal? 4 to 12 m of H. 4 to 12 mm of H. 4 to 12 m of H. So if PAWP is elevated and cardiac output decrease, it's left side heart failure. CVP high, cardiac output decrease, right side heart failure. That's the difference. Okay. Then what are the other assessment you want to do? Monitor MAP and pulse pressure. So you write monitor MAP. What is MAP? Mean arterial pressure. Monitor MAP means what? Mean arterial pressure. So I'll write here. Mean arterial pressure. How can you monitor mean arterial pressure? What is the formula to measure the mean arterial pressure? So you write MAP equal to systolic plus 2 into diastolic pressure divided by 3. MAP equal to systolic plus 2 into diastolic pressure divided by 3. For example, if BP is 120 by 80, here what is systolic and diastolic? Systolic is 120. Upper BP is systolic, isn't it? Systolic. And lower BP is diastolic. Okay. So how to apply this formula? MAP equal to 120 plus 2 into 80 divided by 3. That is 120 plus 160 divided by 3. That is 280 divided by 3. That is 93.3 mm of H. Okay, just write like this. You understood this? So what is the formula? Systolic plus 2 into diastolic pressure divided by 3. Okay, that is the formula. So if BP is 120 by 80, systolic is 120 and diastolic is 80. So 120 plus 2 into 80 divided by 3. 120 plus 160 divided by 3 because 2 into 80 is 160. So 280 divided by 3, 93.3. Is that clear? And next line you write MAP should be minimum 60 m of H. MAP should be minimum 60 mm of H to achieve organ perfusion. To achieve organ perfusion. MAP should be minimum 60 m of H to achieve the organ perfusion. To achieve the organ perfusion. Organs perfusion circulation MAP minimum 60 ആയിരിക്കും. Okay. The next line, monitor the pulse pressure. Monitor the pulse pressure. What is pulse pressure? Systolic minus diastolic pressure is pulse pressure. Systolic minus diastolic pressure is pulse pressure. Systolic minus diastolic pressure is pulse pressure. Systolic minus diastolic pressure is equal to pulse pressure. For example, if BP is 120 by 80, BP is 120 by 80, then pulse pressure is 120 minus 80. If BP is 120 by 80, then pulse pressure is 120 minus 80. 120 minus 80. That is 40 m of H. That is 40 mm of H. Clear? Okay. So these are the things. And what are the other things you want to monitor? In heart failure, the main problem is what? If you are not treating it properly, this can lead to a serious complication called cardiogenic shock. So monitor for the complications like cardiogenic shock. Right? Monitor for the complications like cardiogenic shock. Monitor for the complications like cardiogenic shock. Monitor for the complications like cardiogenic shock. Wrote. So underline cardiogenic shock. This topic is cardiogenic shock. So what is cardiogenic shock? Extreme heart failure can lead to urine. Extreme heart failure can lead to. Extreme heart failure can lead to. Extreme decrease in cardiac output. Extreme decrease in cardiac output. Extreme decrease in cardiac output, comma, extreme decrease in BP. Extreme decrease in cardiac output, extreme decrease in BP below 90/60. Extreme decrease in BP below 90/60. Okay. Extreme decrease in cardiac output, then extreme decrease in BP below 90/60 m of Hg. Then cold skin, confusion, cold skin confusion, urine output decrease, decrease urine output, decreased urine output. Let me explain this, okay? So cardiac output will be less, BP less, cold skin confusion, urine output decrease. So how these all symptoms occur? Just listen, everyone. The heart is not pumping efficiently. So what is the consequence? If heart is not pumping efficiently, all our extremities will not receive what circulation. So our extremities become very cold. So in heart failure patient, especially we can see cold extremity. In cardiogenic shock, extreme heart failure. So cold extremities. And brain will not receive adequate perfusion. So that confusion will be there. And cardiac output is very less means BP also fall. BP decrease. And urine output also will be decreased. Why? Because as I told you, once a heart pumps, 20% of cardiac output is gone for renal perfusion. So if heart is not pumping, kidney will not receive adequate perfusion. So urine output decrease. To remember the cardiogenic shocks, you want to remember the code buck. Buck. B-U-C-K. There you go. Buck. What is the code to remember cardiogenic shock? Buck. B-U-C-K. What is B-U-C-K? B for BP decrease. B for BP decrease. U for urine output decrease. U for urine output decrease. C for cold skin confusion. Cold skin confusion, cardiac output decrease. Cold skin confusion, cardiac output decrease. And what is K? You tell me. What may be the K? K and the K indicates kidney failure. Cardiogenic shock is kidney failure. Perfusion is not receiving in the kidney. So you want to remember the code BUCK, B-U-C-K. So what are the treatment options you write? Cardiogenic shock, what are the treatment? Monitor vitals, especially BP. Monitor vitals, especially BP. Monitor vitals, especially BP. IV fluid to maintain the cardiac output. IV fluid to maintain the cardiac output. IV fluid to maintain the cardiac output. Monitor vitals, especially BP. IV fluid to maintain the cardiac output. Okay, IV fluid to maintain the cardiac output. Then here the most important thing is what? You want to give what? The medications like these procedures like IABP. What is IABP? Intra-aortic balloon pump insertion. Intra-aortic balloon pump insertion to improve the cardiac output. Intra-aortic balloon pump insertion to improve the cardiac output. What medicine you can use here? Cardiac output less. What medicine you can use? Is it positive inotropes or negative inotropes?
Positive
Cardiogenic
and
positive inotropes, dopamine, epinephrine, this kind of medicine you can use. Like what are the positive inotropes? These are the medication which will increase the cardiac output. Okay. Epinephrine ഒക്കെ use ചെയ്യാം. Best medications are epinephrine, dobutamine and all. Medications epinephrine, dobutamine. Okay. So now we'll discuss about cardiac tamponade or pericardial effusion. Okay, this topic. Cardiac tamponade or pericardial effusion. Cardiac tamponade or pericardial effusion. So what is cardiac tamponade or pericardial effusion? Just listen very carefully, okay? The word effusion always denotes what? Fluid accumulation. So what is cardiac tamponade of pericardial effusion? Fluid accumulation in the pericardial space. Pericardial space fluid accumulation, especially in the parietal and visceral layer, especially in the parietal, especially between the parietal and visceral layer. Parietal and visceral layer. Okay. So what is the consequence? If cardiac tamponade occur, what will happen? I'll just show you. Okay. So here effusion means what? Fluid accumulation. Fluid accumulation in the pericardial space. So imagine this area. Imagine this is the area where the fluid is accumulated. I'll just mention here with a blue. This area, fluid is accumulated. So it's a common sense. First, the ventricular area of muscles will be enlarged. This area of muscles will be enlarged. Why? Because of fluid accumulation. Okay, because of fluid accumulation, what will happen? Ventricular area muscle enlarge. So here, what will happen as a result of this fluid accumulation? Ventricular space diminished. Ventricular space diminished. Diminished means what? That capacity diminished. That area of space is diminished. So what is the consequence? Normally, blood from the head and upper extremities will enter through what? Superior vena cava and reaches right atrium. And blood from the lower extremities will enter through inferior vena cava, reaches right atrium. So from here, the circulation cannot enter into the right ventricle. Why? What is the reason? Right ventricle space is less, so it restricts ventricular filling. It restricts ventricular filling. Ventricles will not be filled properly because there is no adequate space. So this will backflow to the head and upper extremity. Okay, where it will backflow? Head and upper extremity it will backflow. So what is the consequence if head and upper extremity backflow occur? This can result in jugular vein distension, edema of fingers and hands. Edema of fingers and hands because it backflow to the head and upper extremity. And here pressure will be increased. That is what? Increased CVP. Cardiac output will be dropped. And edema of the lower extremities because backflow to the lower extremity. Same right side heart failure symptoms you can notice. Moreover, apart from this, you can see additionally many other changes. You can see here these two areas, these two areas will be rubbing each other. Then we can notice what? Friction rub heard on auscultation. What you can see? Friction rub heard on auscultation. Right here. friction rub heard on auscultation. Moreover, there's a chance for muffled heart sound, or diminished heart sound, heart sound. Okay. Narrowed pulse pressure, narrowed pulse pressure, narrowed pulse pressure, and pulsus paradoxus. Pulsus paradoxus. Okay, pulsus paradoxus. Repeating, friction rub heard on auscultation. Why friction rub? These two layer rubbing each other. Friction rub heard on auscultation. Muffled heart sound or diminished heart sound will be the muffled heart sound or diminished heart sound. Then narrowed pulse pressure, and pulsus paradoxus. What do you mean by pulsus paradoxus? You write pulsus paradoxus. Pulsus paradoxus means declining systolic pressure during inhalation. Declining systolic pressure during inhalation. During inhalation. While breathing, systolic pressure will be dropped. That is pulsus paradoxus. So declining systolic pressure during inhalation is considered to be what? Pulsus paradoxus. Pulsus paradoxus. Note, take screenshot. Okay, repeating again what will happen in pericardial effusion. Here fluid will be accumulated. Okay, so once the fluid is accumulated here, what will happen? Ventricular area, there will be what? Enlargement of the this area muscle will be enlarged. This area muscle enlarges. So as a result, what will happen? Ventricles cannot be filled properly. Ventricle, it restricts the ventricular filling, so it will backflow to the superior vena cava and inferior vena cava. You want to remember this two arrow mark. I'll just draw it here. This two arrow mark. Backflow occurs to the superior vena cava and inferior vena cava. So same right side of heart failure symptoms only. So we can see what? Head and upper extremity backflow, which can lead to jugular vein distension, edema of fingers and hands. Inferior vena cava backflow, this can lead to what? Edema of lower extremities. And we can see friction rub heard on auscultation, muffled heart sound, narrowed pulse pressure, and pulsus paradoxus. Okay. In pericardial effusion or cardiac tamponade, there is a thing which is called Beck's triad. You just write like this, Beck's triad. Beck's triad means three classical features. If we see these three classical features, definitely it is what? Cardiac tamponade. Do you know what is Beck's triad? What are the three Ds? 3D. 3D. Okay. First D is decreased BP. Decreased BPM. Second D for diminished or muffled heart sound. Muffled heart sound. Diminished or muffled heart sound. And third D for distended neck vein. That means jugular vein distension. If you see these three symptoms in any patient, definitely it is what? Cardiac tamponade. Cardiac tamponade in the classical features of Beck's triad. 3D. Okay. 3D organ. So management, you right? Monitor vitals, especially BP. Why here also you want to monitor BP? Because of low cardiac output. So any disease where the cardiac output is very less, you want to closely monitor BPM, monitor vitals, especially BP. Then IV fluid to maintain the cardiac output. IV fluid to maintain the cardiac output. IV fluid to maintain the cardiac output. Then what is the treatment here? So here we want to take that fluid out. Here our problem is what? There is a fluid accumulation between the parietal and visceral layers. So we want to take the fluid out by what? Pericardiocentesis. Right? Pericardiocentesis. Like thoraccentesis. Pericardiocentesis. Pericardiosynthesis means what? Removal of fluid from the pericardium. Pericardiocentesis. That means what? Removal of fluid from the pericardium. Removal of fluid from the pericardium. Removal of fluid from the pericardium. That is considered to be pericardiocentesis. Okay. Then treat the exact cause. Treat the exact cause. So these are the treatment options for what? Pericardial effusion or cardiac tamponade. Okay. Next, a small topic, that is arterial disorders. Underline arterial disorders. Arterial disorders. Okay, just listen very carefully. Actually, arterial disorders are mainly divided into three types of arterial disorders. One is peripheral arterial disease, first type. Okay, just listen everyone. Three types of arterial disorders. Peripheral arterial disease. Secondly, Raynaud's disease. And thirdly, thromboangiitis obliterans or Burgess disease. Okay, so I'll just mention this, okay? Thereafter, we will discuss thromboangiitis obliterans or Burgess disease. So first one is, first just to mention arterial disorders. Arterial disorders to mention here. And underline that, and below that you write, first one is peripheral arterial disease. Peripheral arterial disease. That is PAD, okay? Short form is PAD. And secondly, Raynaud's disease. Raynauds, Raynaud's disease. And thirdly, thromboangiitis obliterans or Burgess disease. Thromboangiitis obliterans or Burgess disease. Thromboangiitis obliterans or Burgess disease. In short, TAO. Thromboangiitis obliterans. TAO. So among these three diseases, first we will discuss thromboangiitis obliterans or Burgess disease. What is thromboangiitis obliterans or Burgess disease? Thromboangiitis obliterans or Burgess disease. Burgess disease. So actually, the cause for arterial disease, most of the arterial disease causes are common: smoking, stress, cold exposure. These are the three main causes for what any arterial disorder. Not only thromboangiitis obliterans or Burgess disease, even Raynaud's disease, PAD also. Main three causes of most of the arterial disorders are what? Smoking, stress, cold exposure. Now we can split this word into two. Thromboangiitis. Okay, thrombo means clot. Angiitis means what? Inflammation. So we are studying about artery. So where this clot and inflammation is formed? Inside the artery. Imagine this is an artery. So it usually occurs in the lower extremities. Imagine this is an artery in the lower extremity. When a patient is smoking, what will happen? Arteries will be damaged and arteries will be inflamed. Imagine this is an inflammation. Arteries damaged and inflamed. So what will happen? Our body will react towards this inflammation, and there's a chance for clot accumulation. Clot will be formed like this. So as a result of clot and inflammation in the arteries in the lower extremity, circulation decreases. Circulation decreases. That means there's a chance for ischemia to the lower extremities. So what symptoms you can notice? 5 P's. What are the 5 P's? One is pain due to ischemia. Pain due to ischemia. Because of decreased blood flow, there's a chance for pain. We call it as intermittent claudication. Intermittent claudication. Intermittent claudication. Okay. And second symptom pulselessness. Pulselessness ഉണ്ടാവും. Pulselessness, paler. This area become paler. Polar. Polar means that area become cold because circulation is less. Then paresthesia. Paresthesia means what? Pricking sensation. Pins and needle sensation. Pins and needle sensation. Okay. So what are the 5Ps? Pain due to ischemia, that is intermittent claudication. Pulselessness, paler, polar, paresthesia. 5Ps you want to remember. So wherever the circulation decreases in the extremities, we can see 5Ps. Okay, pain, paresthesia, pulselessness, paler, polar. Okay, so what all are the treatment options? Take screenshot if you want. Treatment എന്താണ്? Mainly we want to advise the patient to stop smoking. If they are smoking, we want to advise this patient to stop smoking. Stop smoking. Avoid stress and cold exposure. Avoid stress and cold exposure. Avoid stress and cold exposure. Then here there is an inflammation clot. So we want to use what? Corticosteroids, an anti-inflammatory. Corticosteroids, bracket you write anti-inflammatory. Corticosteroids and anti-inflammatory. And secondly, anticoagulants can be used. Anticoagulants. Corticosteroids, anticoagulants can be used. Amputation in case of necrosis. Amputation in case of necrosis. Necrosis ആണെങ്കിൽ amputation. Amputation in case of necrosis. Amputation in case of necrosis. Avoid injuries on the affected extremity. Avoid injuries on the affected extremity. Because of delay, avoid injuries on the affected extremity because of delayed healing. Healing ഭയങ്കര delayed. Why? Circulation is very less. So avoid injuries on the affected extremities. Check for any ulcer formation in the extremities because of low circulation. Check for any ulcer formation in the extremities. Check for any ulcer formation in the extremities. Ulcer form ചെയ്യാനുള്ള chance because circulation is less. So check for any ulcer formation in the extremities. Okay. So the other thing is what type of cloth you want to recommend for the patient, especially if they travel to cold environment. Woolen cloth. Okay. So you write recommend woolen cloth. Recommend woolen cloth when they are traveling to cold areas, cold environment. Okay, so these are the interventions. Okay, so Raynaud's disease already I shared in group Raynaud's disease video you want to watch, and heart failure video also I already shared you. Okay, symptoms I already explained. Okay, so just watch these videos, and tomorrow we'll discuss the last portion of this. Okay.